Good afternoon, everyone. We're going to get started in a couple of minutes. We're just going to give folks some time to sign in. We're just waiting a couple of minutes. We're just letting folks sign in and make sure that all of their audio and cameras are working. We're seeing people log in. Thank you for joining us. We're just giving folks a couple of minutes while everybody logs on. Thank you for joining us. Buenas tardes. We're just giving folks a couple of minutes to log on and get situated. We appreciate you joining us. Buenas tardes to everyone who's joining us, especially live on Facebook. You just can spare with us a couple of seconds. We're getting everything situated with IT and our mics, and we're going to start this presentation shortly. Buenas tardes. Good afternoon, everyone. Thank you for joining us today in our anti-racist movement to achieve equity, a virtual town hall. My name is Jenny Carrion, and I am the Assistant Vice President of Civic Engagement at AltaMed Healthcare Services, and also an AltaMed patient. It's my honor to be here with you today to discuss such an important topic that has and continues to impact our communities. We're living a new reality due to COVID-19 pandemic. But there are other important issues such as racism and health inequalities that have affected our communities for generations. It's important to have these discussions and learn ways that we can empower ourselves, our families, and our communities to improve our overall well-being. Racism and discrimination are key social determinants of health, and diverse and racial and ethnic socioeconomic health disparities. These barriers are real and all of our communities are being disproportionately affected. We are pleased to have with us 4 experts in health disparities, social justice, and activism. They will share their insight about ways that we can help eliminate the barriers that are preventing our communities from achieving optimal health and racial equity. Before we start the program, we'd like to remind you that you can send our comments and questions throughout the session using the chat box. Connect directly with our panelists. We want to hear from you. If you're connected through WebEx, please use the chat box, which is located on the right-hand side corner of your screen. If you're joining us through Facebook Live, you can send us comments and questions throughout the comment section. Lastly, if we're not able to answer any of your questions during today's discussion, we'll be sure to follow up with you directly to make sure that we give you the information that you requested. In this session, we're going to discuss how racism is a driving force on social determinants of health and what we can do to improve our community's health and overall well-being. We will also talk about the shift to anti-racism movements this year and the impact that that has had on all of our communities. Mobilizations such like Black Lives Matter movement, because Black lives absolutely do matter. Please join me in welcoming some of our panelists today. Dr. Naina Hurawa, who received both her master's and PhD from UC Epidemiology. In an effort to foster approaches to address health disparities, Dr. Hurawa has written conceptual issues and analysis of racial public health research. She has launched the Breaking the Silence events, a series of one-day conferences and trainings designed to educate and empower women of color and their providers in order to improve sexual health. We also have Mark Anthony Johnson, founder of Frontline Wellness Network. Mark is a licensed acupuncturist and an expert organizer. He is a teacher with both Generative Somatics and Black Organizers for Leadership and Dignity, an organization committed to building Black movement infrastructure and developing Black leaders in an emphasis of transformative organizing, political education, and more importantly, embodied leadership. We also have Dr. Efrain Talamantes, who is a medical director at AltaMed Institute for Health Equity. Since joining AltaMed, he has led services, community-partnered research, and training to advance health equity and medical education. Under Dr. Talamantes' leadership, the Institute received patient-centered outcome research funding, enabling a community partnership that has informed AltaMed's research and priorities. Last but absolutely not least, we have Tasso de la Rocha, President and CEO of Enduring Trailblazer in Community Health. Under his vision, AltaMed has transformed a storefront-free clinic in East Los Angeles, just down the street from Garfield High School, into the largest federally qualified health center in California and among the top 5 in the nation. Mr. de la Rocha always understood the community's health is indivisible from its prosperity. And in 1977, he saw a need. People in low-income neighborhoods were significantly underserved by essential health resources. And by meeting that one fundamental need, he changed the face of one community, then another, until AltaMed became one of the area's largest healthcare systems with approximately 50 medical, dental, and pay sites, staffed by more than 2,800 employees, providing compassionate care to nearly 300,000 patients a year. Tasso, 40 years ago, you saw a long line outside the clinic, and since then, you've worked tirelessly to fulfill a need for culturally inclusive, expert medical care in our communities. How has this journey been for you?
Amazing. It's been an amazing journey. Some things just don't change, however. The pleasure I derive from what we are doing is no different than what got me to enter that free clinic back in 1977 and interview for the position of executive director. I want to first of all thank Jenny for the lovely introduction, thank the panelists for participating, and the staff that has worked so hard to pull together this conversation. As Jenny mentioned, our origins is that of a free clinic. Our founding was the response to the lack of options in medical care to the largely low-income, undocumented Mexican American population in East Los Angeles back in the 60s. If you're too young to recall the setting that paved the way for the East LA Barrio Free Clinic, we were born out of the civil rights movement, the Chicano civil rights movement, which ran parallel to the Black civil rights movement of the 60s. There weren't a lot of resources in our community at that time. We didn't have enough primary care physicians. High school graduation rates at Garfield High School and at Roosevelt High School were pathetic, to say the least. We were angry at how many of us were being killed in Vietnam, people of colors, Black and Latinos, in a war that we had no interest in even being engaged during that period of time. Police brutality in that period was rampant. Police forces had declared war on Black and brown communities. Ruben Salazar, a reporter for the LA Times, was shot and killed inside a building by a LA County Sheriff's Department in one of those peaceful demonstrations in the late 60s. As a matter of fact, that occurred just a few blocks away from where two of our largest sites are presently located. Unfortunately, things have not changed dramatically. Many of the same issues are just as real today as they were in the 60s and 70s. 50 years later, of course, we had the millennials and the Z generation, G generation. They have their own reasons for being angry. But I assure you that my generation and the generation of today are being fueled by the same sort of anger, rage, and discontent that we feel about systematic racism. I am proud, however, to see that I am extremely proud, to be honest with you, to see how many people have actually referred to and went through social medias to share their part of history we didn't learn in school. Protesting to stand up for others. This is the younger generations. Respecting the medicine in a world where COVID-19 is disproportionately affecting Black and brown communities. At AltaMed has dedicated more than 50 years of building up community health. This is not just about giving our community members access to a provider. It is also about providing and creating opportunities in an attempt to end poverty, environmental injustice, eradicating health disparities, and eliminating institutional racism in all its forms. To us, this means providing workforce pipelines to our community. 90% of the patients at AltaMed are minority populations and come from minority populations. 75-80% of our employees are also come from the same communities. We're pushing our high school students to graduate from high school and college, encouraging those students to go on to health professions so that they can provide care in our community once they finish. And in fact, we push them so they come back and work for AltaMed Health Services. It means investing new money in community partnerships so that we can help support programs that we do not have the expertise or the space to provide. It means inviting a diverse range of young people, internship programs of all kinds, medical students, primary care leadership programs, scholars, health fellows, AmeriCorps, to learn. The whole objective is for them to learn about the communities we serve so that they one day can practice in our own communities. It also means hiring staff who speak the language of our patients and understand that the range of language we offer needs to grow with our service area. We often agree that it is on those of us with a voice to speak out for the voiceless. But we all have a voice, and many of us have been speaking for decades. It is on others to choose to seek us out and choose to listen. Our communities, brown and black, have been speaking out on our behalf for many, many years. We protested, we demonstrated, more often than not, alone in that protest and in that manifestation. Corporate America and America responded by organizing a task force, a committee to see what the problems are. They funded one or two community projects and then long forgot us. That has been our history and our experience. Perhaps things may change with COVID-19 and a disproportionate number of Blacks and Latinos being impacted and the issues that have come to the forefront with Black Lives Matters. And it is bittersweet, but also promising that so many people are finally coming out as allies in the mainstream level. There has been a renewed interest not only in Black lives, but in the threat, but in targeted communities, be they Mexicans, be they Muslims, be they undocumented, particularly since Trump came into power. So many of us, immigrants, people of color, indigenous populations, have had to be our own advocates when others wouldn't stand alongside us, at least in the numbers we really needed to be visible. But right now, we're in a position to steer the discussion into one of how the climate we're in is not about Black versus white or Latino versus white or Black versus Latino, but it is all of us against bigotry and racism. We're seeing a similar advocacy for women and for the LGBTQ community and those with disabilities. This is somewhat new, and it has energized many of us. I will tell you that I have been totally impressed at what the Black community has been able to do in response to COVID-19 and the police issues, the issues related to police brutality. 63 CEOs and executives recently sent out a letter and a call. The 63 were presidents and CEO of major foundations for a call to help with COVID-19 and understand the adverse impact that COVID-19 was having on Black and Latino communities. That was phenomenal. But more important, as did the Black Caucus in Washington, D.C., not only did they took up that issue around COVID-19, but also immediately pivoted, and introduced probably one of the most important pieces of legislation in recent history to deal with the issue of police brutality. They pivoted instantly. And it is Karen Bass and the Black Caucus's piece of legislation that's being considered in Washington, D.C. I look forward to hearing what and ultimately seeing where this all ends. At some point down the line, I hope to follow those steps in Latino communities and learn from our brothers and what they have done so well, and to continue to garner the support of a much larger audience. Perhaps this time we'll see the end of what otherwise has been an unjust society. I look forward to hearing from the other panelists, and again, I thank you for inviting me today. Mil gracias. Thank you very much.
Hello. You're invited anytime, by the way. Also wanted to share a couple messages from Facebook. We got one from one of our favorite local artists, Alexis de la Rocha, that says, "Way to go, Castelo." I also wanted to share with all of us, with everyone watching, that if you're able to submit some words that you're experiencing right now, how you're feeling. This is a time of empowerment, of fear. We want to be able to hear from you and let you know that it's okay to be with all of those emotions that you're experiencing right now. I now want to have the opportunity, as we continue this conversation, to talk to one of our experts as we understand that systematic racism and other injustices impact our overall health in our communities. And to speak more about the drivers of social determinants of health and overall health equity, I'd like to welcome our very own Dr. Efrain Talamantes. You're on mute. Okay, perfect. We can hear you, Dr. Talamantes.
Well, real pleasure to join all of you and this distinguished panel. I'm really glad to be here today talking about this very important topic. I wanted to start off by just sharing a beautiful painting by one of our local artists here in East Los Angeles, Jose Ramirez, who I follow quite closely. And this is an actual painting that was commissioned by AltaMed, specifically Cástulo and Zoila, who is our Chief Administrative Officer, Zoila Escobar. And really sort of encapsulates what not only we stand for in terms of our mission, but what we have been dedicated to since 1969. Really, our commitment to advancing health equity is a matter of social justice. As one of the largest federally qualified health centers in the country, providing comprehensive care, we take this matter seriously. We saw the COVID-19 pandemic, and we started to understand that it was going to magnify social inequities. We were keeping an eye on law enforcement violence, as we recognized that this was particularly impacting Black and Brown communities. And we really, once we started to see the Black lives that were senselessly lost, we took a moment, not only of remembrance for many of the lives that have been lost, but also we took a moment of non-silence, and this is part of it, bringing this panel together. And we stand in solidarity with the Black Lives Matter movement, our Black brothers and sisters who are really mourning losses every day, and we still continue to see more, and we need to put a stop to it. So why is this important? From the AltaMed Institute for Health Equity, one of the things that we were founded and put together to achieve was helping all our patients achieve optimal health. That means ensuring that we understand the conditions in which we are born, we grow, we live, we work, we age. We call that the social determinants of health. And our vision is to work together with all of you, our teams here, our community partners, our patients, your families, to realize a collective well-being, optimal health. And what does that mean? That means we have to eliminate obstacles to health. Poverty, racism, discrimination, lack of information, and the consequences. What we really see today is we have powerlessness in our communities. We need to change that. We need to move towards a place where our communities are valued, where we're valued as part of a greater solution to advance health equity. If we could go to the next slide, please. When I think about this work and the progress that's been made for generations, I'm one of my first and more important influential historians is W.E.B. Du Bois, who did a lot of work around understanding or helping us understand the impact of racism. That racism is bad for your health and ends up in death. And the fact that we're still allowing racism to continue is not acceptable. And moving to anti-racism, where we actually take a stand, well, that allows us to better understand where we're coming from. We used to think equality was enough, where everyone gets their little box, but hey, what happens to our little guy? He can't see over the fence, so he doesn't get to enjoy the game or get the benefit of having that health, right? Then we moved to equity. We said, well, maybe we give the little guy a couple boxes, and now he can see the game. Yes, but we need to identify what is the barrier. And the barrier is that this fence is not helpful, doesn't allow people. It excludes folks. specifically those of us who may come from underrepresented backgrounds. And so when we think about justice and really moving is we want to remove the barrier. We want to look at the laws that exist and change those laws, come together, use our voice as community and inform this law is not working for us anymore. This law is actually causing us to have bad health, right? Racism is bad, bad for your health. So we'll go to the next slide. When I think about this in my own training and as a physician, and I've had the opportunity to train in many places, it's clear to me that many times as physicians, we approach the work the same. We say, well, I have a 65-year-old patient here, Mr. S, or I have another 65-year-old patient, Mr. L, or I have another 65-year-old patient, Mrs. W, and they all have diabetes. Well, we have to think beyond that, right? Think about what you already are assuming based on the pictures you see, who they are, where they come from, and sometimes how does that impact the way we treat them, the way we understand them, right? The way we judge them, right? There's been plenty of studies, hundreds of studies that show that we as healthcare providers and our teams sometimes miss it, right? We prejudge our patients. We use our bias that allows racism to creep up into our care delivery, and that inhibits us. That limits our ability to connect with patients. That limits our ability to get our patients better. So as you go on, and I want you to just think about when you interact with anyone, and not just healthcare, but think about what are the misconceptions you may have. And instead of judging people and saying, well, maybe you eat too many tortillas, or maybe you have a healthy lifestyle, or maybe you shouldn't be eating pig's feet, and I'm using that from some studies that I was reading in preparation for this. Let's not do that. Let's ask people, tell me more about your experiences. Let's use that experience to inform the way we can care for them and go above and beyond in delivering the best possible care. We'll go to the last slide. I'm just very proud of many of you who are listening in today, because I know that many of you have started to shift your thinking beyond racism, just saying it, just allowing it to happen, to anti-racism. And this is one of my more recent favorite authors that I was actually reading before, well before this work, thanks to many of my colleagues who share great stuff on Twitter. So if you're on Twitter, follow us. But I would say that Dr. Ibram X. Kendi writes extensively about how we can be better allies, anti-racist, really change and move to justice. And not just to justice, but justice with an equity lens, meaning that we understand how to undo racism and consistently, persistently identifying it, calling it out, describing it, and then dismantling it. And again, to our mission at AltaMed, we're all about eliminating and dismantling disparities. So really glad to be here. Looking forward to your questions.
Thank you, Dr. Salamantes, for sharing such important details. I also want to mention some points that we've been reading on Facebook. Juan just mentioned that systematic racism is absolutely a public health issue, and we just wanted to acknowledge that we absolutely agree with you. And we've been hearing lately a lot about how communities are impacted by racism, but there has been a shift from racism, as this book identifies, to anti-racism movements. And Dr. Harral is here to provide us her insight on this topic. Doctor?
So we find ourselves in this moment, in an incredible moment of change, of potential change. We see this coalescing of energy, people, institutions, and statements around the value of Black lives, around the realization of all the ways in which our lives are endangered, and around a deeper grasp of systemic racism and our society's overinvestment in the criminal justice system, quote unquote. The policies for advancing the cause of racial equity and social justice in this moment are enormous, but there are also threats at every turn. In my opinion, one of the threats is that so much of the language and the discussion has been framed around terms like white privilege and white supremacy. Now, if we actually have an in-depth understanding of these concepts, it can really go a long way in helping to address anti-Black racism that also occurs within people of color, and to build coalitions across Black, Indigenous, and other people of color communities. But a surface understanding can lead us astray into Black and white thinking that does not give us the vocabulary that we need to talk with one another and to root out and heal racism and xenophobia that also occurs between Black, Latino, Asian, and Pacific Islander groups, Indigenous and Pacific Islander groups, and sometimes within our organizations. Next slide, please. Or, well, actually, no, sorry, last slide just for one moment. Thank you. So you'll see on the right of this slide that people of color now comprise 40% of the U.S. population, and our country is rapidly becoming a majority-minority country, meaning that people of color will make up over half the population of the U.S. by 2045. And that makes this work that we're doing internally all the more urgent. Next slide. And, you know, as I said, I think our vocabulary needs to expand, and I've seen some examples of where that's happening. I think this effort, Somos for Black Lives, is one example, but there's other ways in which it also could continue to expand, and I feel like this discussion is a great example. I wanted to share a little bit of my history and why this is so important to me. I first came to Los Angeles before the 1992 rebellion, to do an internship at an organization that provided legal and social services to Salvadoran refugees in Pico Union. I came back after the uprising to go to graduate school at UCLA and never left. Most of my work history has been with organizations that were predominantly Latino or Black, and my community-engaged health research has been with Black and Latino-led health organizations, largely health organizations. In that time, along with the tremendous positive work that I've observed, I've also seen instances of outright racism and of benign neglect and how we relate to one another. And I want to share just a few of those as an examples of the work that we have to do internally. I failed to, and I'm not going to name any organizations, but just to share some examples. I failed in my efforts to convince an African-American institution to boldly speak out against Trump's anti-immigrant executive orders. And I've partnered with a Latino organization that had to be talked out of getting rid of Martin Luther King Day as a paid holiday. In that same organization, a colleague of mine was leading a support group of Black men in one room one day, when a Latina staff member in another part of the building could not find her wallet. When the group finished, he was told by management that the men in the focus group could not leave until the wallet was found. Something similar happened to the only Black boy in my daughter's third grade classroom. The substitute, a Latina, misplaced her cell phone and then managed to find an excuse to search the backpack of just one child for it, the only Black boy in her class. Another memory, though, also comes to mind. This was probably over 20 years ago. I was standing outside of an African-American-led AIDS service organization with some outreach workers. I believe there were 4 of us, all Black. A paletero walks by, and out of nowhere, one of the outreach workers kicks the wheels of the man's cart. The man looked at us bewildered, and my guest, seeing that there were 4 of us, decided to walk away doing nothing. But I was fuming. I asked the outreach worker, how could he have done such a thing to someone just walking by? His reasons had nothing to do with the man himself. He ranted about how hard it was to get a job in South LA as a Black man, and about all the opportunities to make a living that, in his words, were taken by Latinos. In that moment, he saw the paletero not as a person, but as a symbol of lost prosperity. Next slide. I said to my husband the other day that even if we had video footage of many police killings leading up to it, If George Floyd's murder had happened 20 years ago, there was no way that we would have seen such a broad coalition of racial and ethnic groups speaking out against it, at least not in Los Angeles. The divisions and tensions between Blacks and Latinos and Asians, who were often fighting for their pieces of a very small pie, and whose children were acting out the same tensions that they observed in their parents, were just too intense. But the pie was never that small, and so much more of it was being used to fund the police than we ever realized. And I know that you're going to hear more about that in the next speaker. But it's this realization about how big the pie really is that makes clear that we can have people all over the world saying that Black lives matter without diminishing the cause of Indigenous lives or Latino lives or the lives of poor white people. But we all have to commit to continuing to showing up for one another. If you could flip the next image too. The organizations that I talked about earlier, like most organizations in South LA, served both Blacks and Latinos. Not only did that outreach workers' action menace an individual, it had the potential to do tremendous damage to the agency's reputation in the Latino community, just as the negative ripple effects had the potential to reach many people other than the Black men in that focus group, in that support group. This is the business argument for our organizations to be anti-racist. Not doing so hurts our bottom line. It has the potential to stymie our missions. But doing so, being anti-racist, requires an understanding of how immigration policy and zoning and housing policies tend to pit people of color communities against one another. Doing so requires a language that goes beyond Black and white, to include a description of a melanocracy that values lighter skin tones over darker skin tones, even within Black and Brown and Asian communities here and really across much of the globe. Where I start this work, and one of the things that I think people of color organizations can start this work, or one of the ways in which they can start this work, is to help staff in understanding the particular racial history and dynamics of the communities in which they work, and to help develop dialogues around the relative privilege and disadvantage of the statuses that each of their employees enjoy. For example, yes, I am a Black woman, and there are a host of disadvantages and often negative assumptions that come with those categories. But I also recognize that I have a certain amount of light skin privilege, and that I have privilege as a cis woman that my transgender sisters do not have. I recognize that as a child of two parents with college degrees and a father who was a professor, I went to grad school, and I come to my job as a professor with a set of invisible codes that my students and my colleagues who are first-generation college graduates may not have. These codes can open doors to opportunities and networks and quote-unquote right ways of doing things that our schools often don't teach us. If I forget that, I may do a disservice to my students and blame them for shortcomings that are actually not theirs. We also need to make space for collective activism within our organizations, activism on behalf of our clients and patients, a mission statement accompanied by a set of organizational values can provide clarity about the types of causes that an organization supports and give room for employees to collect petitions, signatures, or otherwise organize around them, with the key goal being the education of staff and patients. The last 4 years have reminded us of the collective threat to our health, safety, and freedom that so many of us live under all of the time. This threat has helped to bring so many of us into the streets, but it is the internal work that we do as individuals and that people of color organizations are doing that will sustain the movement over time and keep it from fracturing. I'd like to close by talking about how it is that health organizations are tied to the criminal justice system and how they can minimize their investment. There are at least 3 places we can look. First, security policies. The amount of investment into security and its associated value and cost within our organization. Second, and if you go to the last slide with the foster care, Policies around domestic violence. Yes, there are mandated reporting requirements that we all must follow, but bias inevitably creeps into decisions that providers make about what gets reported and who gets reported. Can your organizations track data on reporting to assess for potential bias? Can you offer additional support to families under extreme stress and risk of violence for prevention so they can avoid the need for ever being reported at all? And finally, what alternatives can you offer to victims of domestic violence who fear reporting precisely because of our society's overinvestment in policing? Finally, hiring policies. How do you solicit information on criminal records from potential hires? Will you hire people with them? And how can you work to become more inclusive in your hiring practices, given that we know that incarceration and criminal justice systems disproportionately affect people of color? As you can see in this slide, at any given time, 5% of Black men are incarcerated, nearly 5%. Nearly 2% of Latino men are incarcerated, and this is much lower than what we see for other groups. That's a tremendous lost investment of people who could otherwise be contributing to their communities and should be given opportunities to contribute to their communities after they've paid their time. One of my colleagues at UCLA is a professor by the name of Bob Brooks. He helped to run the Robert Wood Johnson Clinical Scholars Program, a highly competitive program that Dr. Talamonte has also completed. In the early 1970s, one of the first applicants to the program was nearly dismissed because of his criminal record. Dr. Brooks threatened to quit if UCLA would not admit the candidate, and he eventually prevailed. That person was Dr. David Thatcher, who went on to later serve as the U.S. Surgeon General and Assistant Secretary for Health. His particular criminal record was for various acts of civil disobedience in the civil rights struggle. Now, I recognize that many of the people who apply to work for AltaMed or CDU or UCLA may have less, quote-unquote, noble charges on their record. That does not mean that they, like Dr. Thatcher, cannot go on to do great things for our communities and our organizations. In fact, in my work, particularly my work around incarceration, I've had the privilege of working with many people who have records that have been tremendous assets to our team, to their families. With that, I'll stop.
It's so important to recognize our own biases and better understand the values and principles that we share to adopt and help eradicate racism. I want to mention that one of our Facebook posts we just received from Alexis Loya also recommended another book that I've actually read, and it's really good, Unapologetic, A Black, Queer, and Feminist Mandate for Radical Movement by Charlene Carrethens. So thank you, Alexis, for giving us that recommendation. The power of community activism is undeniable, but there are effective ways to achieve the change that we need and expect. And as a lifelong organizer, I value the power of collective action so much. And I am thrilled to welcome Mark Anthony, who will share his insights based on his experience as a community organizer. Mark.
Good afternoon, everyone. I am super grateful to be on this panel with so many heavy hitters and legends in the field. Thank you so much for inviting me to be a part of it. Thank you, Dr. Hawara, for everything you just named, Dr. Talamontes, and certainly Casula de la Rocha for everything that you've offered so far. It's beautiful context to this conversation. You know, I want to situate this moment we're in a historical context as well, and to say we're just coming off of Juneteenth, right? This is a really important holiday for Black people across the country. This is the day that represents when the announcement of the Emancipation Proclamation and the signing of it was announced, and that information got to enslaved African peoples in Texas 2 years after it was signed. And I raise that because you know, I think we have to situate all the work that we're doing in this historical context, in a context of historic justice denied, but also in the really amazing moments of solidarity and movement building that has happened as part of those really important abolitionist events, right? And so we can think about the levels of solidarity that existed in aspects and branches of the Underground Railroad that not only went north to Canada, but southwest to Mexico, right? And we can see the long tradition of Black-Brown solidarity against anti-Black racism. But then certainly what we know is that every moment where there's been a movement to radically change society in some really powerful ways, healthcare providers have thrown down and have been on those front lines, certainly in the movement to abolish slavery, certainly in the movement to abolish segregation and Jim Crow and lynching. And in this moment where organizations across the country, communities are calling and posing some very deep fundamental questions around policing and incarceration, we have such a powerful opportunity and mandate to be present in these conversations, such as folks like the Medical Committee for Civil and Human Rights, which supported the Black Panthers in developing wellness clinics across the country, and that became a source of community-based power. And so I ground us in that to talk about what is this current moment that we're in. If we could go to the next slide, please. Last Friday was Juneteenth, and the Movement for Black Lives is a host of organizations that includes Black Lives Matter and across the country. And we had over 500 actions from Friday to Sunday for organizations calling for fundamentally reinvestments across the country. And this is one of those actions. It was a direct action in Washington, D.C., where folks are repainting the streets. Next slide, please. To really say that Black Lives Matter, and what that has to mean is defunding the police, right? And this is something that's become a rallying cry across the country. And I want to take a moment to just talk about what that means and why people are even calling for that at this point. And certainly we know that this is catching a lot of momentum. We've seen the New York City Council put forth a discussion to move $1 billion out of the New York Police Department into Black communities. We've seen Austin do something similar. And next slide, we see Los Angeles is also in that conversation. Los Angeles City is also moving in a conversation around how to move money, at least $150 million away from the Los Angeles Police Department and into Black and Brown communities. And I think this is really important. Black Lives Matter LA has done a tremendous job of leading the People's Budget LA. And I encourage all of us, if you haven't already, if you haven't been involved in those actions, please visit People's Budget LA and see the really tremendous work they did to survey 50,000 people to say, what do you think the budget should look like? And overwhelmingly, folks said we need to invest less in policing and incarceration and more in housing security, mental health and public health, and those type of things. And so on the right here, you see this is an action that we did, Frontline Wellness Network. We are a network of healthcare providers who understand criminalization and incarceration as a public health crisis. And we had roughly 500 folks, many of them providers in their scrubs and in their white coats, marching on Twin Towers Jail, which you see in the back. And I think it's really important to note that part of what anti-Blackness looks like is that many of the primary vectors of care that folks are faced with is through police contact, right? I have a loved one who has schizoaffective disorder and very much knew very recently that his symptoms were getting worse. He was starting to hear voices, went to a clinic to get checked in, tall, dark-skinned, 6-foot, Black man, and said, look, I know I'm about to get worse. I know I'm about to get into a full-blown episode. Can you check me in? And they denied him, saying, look, you're not a danger to yourself or others, and so we cannot check you in. And I think this poses a very serious and fundamental question to how health is structured and access to health is structured. Because what does it then mean that Black people have to be considered dangerous to themselves or others in order to receive critical care? Right, and particularly as we're seeing time and time again, that the presumption of dangerousness for Black people is often what leads to police brutality and anti-Black violence across the country of our folks, right? And so what we've been saying is we actually have to call for deep reinvestments, investments in economies of care, and investments in communities of care, and really checking and looking at how the historic investments that we've been a part of have actually shaped the infrastructure that we're in now. We very much see health in the health of our folks, the health of our clients and patients. I myself am an acupuncturist and support Black Lives Matter with providing trauma-based acupuncture because they're out there on the streets so regularly. But we very much know that health is also the outcome of what political struggles have been waged throughout history, right? The civil rights movement was a political struggle. The abolitionist movement of slavery was a political struggle. And those outcomes impacted our well-being. And we're in this moment where a struggle is happening around how do we want to fundamentally prioritize the well-being of Black people. And if we can go to the next slide, what we know about Los Angeles, as Dr. Hawara really so clearly lifted up, is that 71% of the LA County budget, and we're talking county now, the news article that you saw on the previous slide was LA City in regards to moving $150 million from NYPD into Black communities. Now we're talking about the county, and that is the sheriff's department. That is, those are the folks who do patrol and actually run the jails. And 71% of our county budget goes towards sheriffs, district attorneys, and probation, right? And we are calling for a shift in that. And part of what that means is that the outcomes of folks who need care, who need services, and the what I call the triple crisis of houselessness, COVID-19, and anti-Blackness in the form of criminalization and incarceration really shows up in the health outcomes of our folks. You know, and we can look at folks like Million Dollar Hoods in UCLA has done some tremendous work to track some of the data around how much we spend on incarceration, right? We know that in recent years, between 2012 and 2017, the Sheriff's Department spent $80 million and $56 million invested in policing folks and incarcerating folks in Lancaster and Palmdale. Also spent $23 million policing and incarcerating folks in Long Beach, $34 million policing and incarcerating folks in Compton. All of these cities have Black populations that are at least 30% of that city population. And we know the reasons for arrest include very much, the top reasons for arrest are very much public health related. They're substance use related. They're DUIs. They're having a controlled substance, having not showing up to court. These are things that we actually don't need law enforcement to respond to, but we can have other solutions that are more effective. Other public health, other harm reduction solutions that are more effective. We know that when people have greater access to substance use treatment, it works. We know when people have credible messengers such as our peers, our folks on the block who are supporting people and getting connected to services, that works, right? And we know that we don't need to be policing folks who are houseless in Los Angeles County. We need to be getting folks housing, right? And so some of the things that we've seen, and this is some of the county data that we know, is that the majority of all houseless arrests come from Black folks, and Black folks make up 43% of the houseless population. And according to the Department of Public Health, 40% of houseless people who have died in recent years in Los Angeles County had some contact with the criminal legal system, the Sheriff's Department, or the jails. 62%, in fact, had some contact in their lifetime, and 40% had some contact within the last previous years. And so what that communicates is that interventions and seeing law enforcement as a mechanisms to interrupt people's lives who are in a crisis or who need housing, who need services, is not actually saving their lives. It actually is connected to this trajectory of mortality. And so what we're saying is that we need to actually restructure the budget. And so if you can go to the next slide, when we say defund, many organizations across the country actually have ideas around that. Some people, when they hear it, they're like, oh my gosh, it's kind of scary. Like, what does that even mean? But we know, the Minneapolis City Council just approved a motion to disband the Minneapolis Police Department. And they're literally moving a motion to create a Department of Community Safety that will look at community-based solutions, violence prevention, those type of things. In Los Angeles, we actually have solutions. There are infrastructure mechanisms we can invest in, right? And if you look at the last year of work that we've done at the county, as part of a broader coalition, Frontline Wellness Network within the Justice LA Coalition helped stop a $4 billion jail from being built in Los Angeles, a mental health jail. And while we know that Black folks are 8% of the county population, we make up 30% of the jail population, 41% of the jail mental health population, and that has to shift, and that shifts by moving resources to where they should go. And this report, Care First, Jail Last, is a wonderful report that lays those things out, lays out very clear strategies. And I encourage folks to look them up to see how we can invest in those things. And so when we say defund, we may move resources away from strategies that have not worked. And we have the historic memory of having organized since 2014 when Mike Brown was killed, since 2012 when Trayvon Martin was killed, and before, to know that a lot of the reforms we've been pushing for that we had hope in did not prevent the loss of life and the taking of life of George Floyd and so many others in Los Angeles County. And so we're looking for something more fundamental. And we proposed, Justice LA has proposed a Care First budget. And we're asking you to support us, asking you to support and plug in into actually reimagining what Los Angeles County's budget can look like, right? And one of the ways you can do that is you can plug in by texting us. Text Care First Budget at 213-325-1649 and take our survey. We're trying to replicate a similar process at the city level and say, look, we can have a chance to shape the budget, to reallocate resources. We have a board of supervisors that is not only sympathetic, but is trying to move some of those things. And one of the biggest opportunities we have coming up is on July 7th, the county is going to look at how it can close Men's Central Jail, how it can actually close that facility. We have 5,000 less people in Los Angeles County Jail right now due to COVID-19 and due to the pressure to get people out because of how many people are in danger of getting COVID-19 in the jail context, which was never meant to prevent disease, but often has reproduced disease. And so the question is, how can we close Men's Central Jail, take the cost savings, and invest in things that prevent people from going into jail or having police contact in the first place? And we ask you as healthcare providers, as medical providers, as researchers, as students to throw down with us and join us. And so we see folks are already texting in. We're excited to have you, and let's get it cracking, y'all.
Thank you, Mark. I'm personally so excited that the President of the United States has to drive through Black Lives Matter Street every morning as he goes in and out. That just thrills me. And as most of you know, the goal of this conversation is to not just talk about what's happening, but actually do some actions to accomplish some of the things that are happening and are impacting all of our communities. At AltaMed, we have a very robust civic engagement department, and the goal of that department is to remove systematic and institutional racism that's plaguing our communities. And like many of you, I am pained by everything that's been happening. Right now, we're talking about George and Brianna and Ahmoud and Andres, and before that, it was Eric and Sandra and Michael, and the list just goes on and on. Can we show the next slide? It took 8 minutes and 46 seconds for Mr. Floyd to die at the hands of the Minneapolis Police Department. It was 4 the days it took before Officer Derek Chauvin was arrested and charged. It was 6 the days when an independent autopsy determined that his death was by homicide by his neck compression. 846 are very important numbers. Next slide. 0 is the time that we have to waste. We'd like to. The next slide is the call to action, Yudvi. The call to action that we'd like to remind everyone, we'll probably need to go back 2 more, is to download the app My Vote My Health. We have an application that AltaMed created and we're very proud of, and this will give you up-to-date insights on what's happening, some policy recommendations that we have, and some updates that's taking place right now, like the ones Mark mentioned. So you can just push your computer screen to the app and take a picture of it, and that will download it. We also want to remind you that the census is very important and that billions of dollars in housing and schools and healthcare depend on it. We've got to make sure that we all fill that out. And lastly, we want to support Assembly Bill 1196, which is authored by Assemblymember Mike Gibson, and it will, if passed, it will eliminate the use of carotid artery restraint in law enforcement. So these are some of the things that we can do today as we continue this conversation. Next slide. We want to now leave we want to do some of the questions and answers. I know we have just a couple of minutes, and if questions and were not given and answers were not received during this presentation, please know that we will be following up with everyone that has them. One of them that was just sent in was, what is your understanding of the origin of racism and its relationship to economics and how that shapes societal change? Dr. Nina might be able to give some insight into that.
History around this. Can you hear me? There's a history around this, and it's very much tied to colonialism and to slavery. And so really one of the things that people say, and it's very true if you look at the history, is that race is a product of racism. There was a need to dehumanize certain groups for economic gain, to be able to take their land, to be able to harm their bodies, and race was a structure for doing that. And so if you look at early categorizations of human beings, not only were their races defined around not really scientific categories, but they were literally set on a hierarchy with whites at the top and darker skinned black people and native indigenous people at or near the bottom. And but that was all about economics. That was all about being able to justify the way indigenous people were treated in slavery.
Would you like to add something to that? I think you're on mute.
No, actually it didn't. Thank you, Dr. Herrera. I think it was super clear. Thank you so much.
Dr. Talamantes, one of the things that we also was asked, and I think as a father of young children, this resonates with you. What are some of the elements to raise a generation that will contribute to change that we want to see? We can't hear you, Dr. Talamantes.
Yeah, I would say that it's important to have these important discussions with our children. My daughter, who's lighter skinned, has come home crying because her little friends don't want her to play, and her little friends may have, blonder hair or blonde hair per se. And so I think those discussions of understanding that children do recognize racism from an early age is important. We may not know the answers. I think our children know that we might not have all the answers, but really understanding their feelings as they encounter racism, calling it out, making sure that we call it out when they may make a decision based on another child's skin color or because they look different. They may have a disability or something. Being able to have those open discussions with them is really important. And I would say that our knowledge has and continues to evolve in these areas. Both, I think the Latino community, to all of you who que hablan español, ahora entendemos que el racismo hay más información, más educación para que nosotros también seamos antirracistas contra el racismo, para poder combatir muchas de las desigualdades que vemos en la comunidad. I think there's a lot more that we have to offer, not only in English, but in multiple languages. El racism is global, and we saw that in this latest movement. El racismo es global, no nomás es algo en los Estados Unidos, ocurre en nuestros países también. Tenemos que combatir eso. So I just we got to keep having these discussions. And then, yes, hold our educators accountable too. I think having our educational systems, investing in this type of education is also important, not shying away from it. Thank you.
I appreciate that. I'd like to also remind everyone the importance of speaking our words into actions and that our words do matter. Mr. Floyd's words still pierce in my head. Please, I can't breathe. I didn't do nothing serious, man. It's my face, man. I can't breathe. My neck hurts. Please, please, I can't breathe. Please, man. I'm claustrophobic. I can't move. Mama, mama. George Floyd's mother was not there, but he used her as a sacred invocation. I'm a mother of a 10-year-old Black girl, and since I saw that brutal video, every time she calls Mama, I can't get the image of Mr. Floyd's head out of my mind. If going forward, we're going to channel our justifiable anger into peaceful, sustainable, and effective action, then this moment can be a really turning point. And I thank all of you for joining us today, because I really believe that together sí se puede. I want to remind everyone, if you have any other additional questions, we can absolutely reply to you after this segment is over. We appreciate you joining us, and please know that AltaMed is committed to empowering our communities and amplifying their voices through effective civic action. We thank all of our panelists. We also want to remind you that AltaMed is doing everything to protect our communities and provide quality healthcare they deserve. We currently have 5 drive-through sites of COVID-19, and as we're seeing these tests and these cases peak, we're here. We have testing sites free, open in LA and Orange County that are open to everyone. These sites were set up to help reduce exposure at our healthcare centers, but more importantly, was set up to increase the access of care in our communities. We have the information online, and you can please feel free to call us and visit us at My Vote, My Health if there's any questions or any additional information that we can support you with. Thank you for joining us, and we look forward to continuing this conversation and these actions.
Thanks, Jenny.
Thank you.
Thank you, everybody.
Thank you, Cartelo.
Sure.